Hi there, and welcome to the HDFS Career Podcast. My name is Dr. Lori Bullock, and I'm an assistant professor in human development and family studies at MSU. I teach several courses in the department, and one of them is HDFS 270, which introduces students to this major and to the field of family science. Quite often, students who are new to our major are not quite sure of the career options they have with a degree in human development and family studies. Some students know exactly what they want to do, and some students aren't quite sure and can sometimes feel overwhelmed. And there are other students who are in our major but plan to pursue a career in the healthcare field. These would be students who know that they want to be nurses or doctors or child life specialists, occupational therapists, and so on. The purpose of this podcast is to bring professionals on from many different areas. Each episode, I invite a professional from the community who has a background in HDFS or one that is similar to HDFS. I'm so excited you joined the podcast, and I hope today's episode will be helpful to you as you consider your career options. Hello, HDFS students and colleagues. We have a great guest for today's episode, and I am so excited for you to meet her. She is Dr. Megan Maas. She is an assistant professor here in HDFS, and her work sits at the intersection of sexual violence prevention and sexual health promotion. Dr. Maas received her PhD in 2016 from the Pennsylvania State University as a predoctoral fellow funded by the National Institutes of Health. Her award-winning research focuses on adolescent sexual socialization with an emphasis on the bidirectional role that social media, sexting, and online pornography play in the development of attitudes and behavior related to sexuality and gender. As a developmental psychologist, Dr. Maas investigates processes of sexual socialization, or how we learn to be sexual beings through cultural norms, media experiences, parenting practices, and school environments. As a prevention scientist, she integrates feminist frameworks that help to explain gender inequality with theories of behavior change to mitigate sexual violence and promote sexual well-being during adolescence and emerging adulthood. For example, her current work examines online sexual misconduct in K through 12 educational settings and evaluates programming to prevent sexual harassment of students and educate public workers on the realities of online sexual violence for today's digital native youth. Dr. Maas is concerned by the fact that women and girls have gained greater power in educational, social, and political and economic spheres, but remain disproportionately exploited for sexual purposes, both publicly and interpersonally. Her work responds to this problem through changing the way that we socialize young children and adolescents to conceptualize and engage their gender and sexuality. Through exploration of and intervention in the primary sexual socialization agents, that would be parents, schools, peers, and media, she aims to transform this final frontier in gender inequity. Born and raised in California, Dr. Maas earned her bachelor's degree in psychology from California State University, Sacramento. As a certified health educator, she developed a popular lecture series which integrated peer-reviewed information on pornography use into sexual health and violence behaviors. For the last 10 years, she has been invited to talk on this subject for audiences of college students, parents, and mental health professionals at universities and organizations across the country. Dr. Maas, thank you so much for joining the podcast today to share your career experiences. Your work is so intriguing and so important that I'm super excited to have you here and for my students to learn from you.
Yeah, thanks so much for having me. I didn't realize that all of that was on the website. It sounds like my long, 10-year research statement, but it's kind of fun to hear it all combined. But I'm really happy to be here and talk with you in a way to help our students.
Yeah, that's great. Yeah, you've done so much, and your speaking engagements they're always so engaging, and give such really important information.
Thank you.
Yeah, you're welcome. So, on to the questions that I have for you today. Can you first tell us a little bit about you and a little bit about the work that you do in HDFS?
Yeah, so I have been an assistant professor in the department, gosh, for a long time. Um, and I think my favorite thing to do is teach our undergrad human sexuality class, HDFS 445. That's where I get a lot of encouragement and inspiration and, consistent feedback from students and young people. And so that really helps feed into my research questions and shape the questions that I ask. Um, and that's what really led toward a few of my research projects. So, like you described, I'm mostly research anything kind of related to sexual socialization, really with media and sometimes with parents, but now I'm also working with schools, but it really is all kind of tied together to this online context that's now really driving and shaping much of youth interaction. And unfortunately, that means that there's a lot of new ways to perpetrate sexual harassment or sexual violence in the form of, coercive sexting or sharing, the non-consensual sharing of nude images and things like that. And through teaching HDFS 445, I've heard very consistent stories each time I've taught it from students reporting on their experiences with this type of thing in high school. And unfortunately, it's really difficult to go to the high schoolers themselves to get the data that we need to really, inform policy and things like that. But I'm glad that I am able to at least try to do what I can based on the feedback that I get from students about their experiences. So I feel like that's kind of my process here. I mean, you spoke about my content and things that I've done, but I feel like I'm really kind of going from the classroom to tweaking the research, and then that makes me think differently about what I teach and so on. I also teach adolescent development at the graduate level, and then I used to teach research methods at the graduate level too. So I'm really passionate about research methods, not as much as my other what we would call, I guess, substantive areas of work. And then I've also taught for the Jensen for a few years. As a faculty fellow. I teach their introduction to women's and gender studies to undergrads. And so that's sort of another place students could find me, and another way that that feeds into my research and so on.
I love that what you learn from your students and the human sexuality class just informs the direction of what you want to do, because it sounds like you learn a lot from them.
Oh yeah,
Um,
for sure.
yeah, yeah, that's
Yeah.
awesome. And I hear from students every semester whenever you get a chance to take it or to teach it, how much they love the course.
Oh,
Um,
that's so sweet.
yeah, it's like one of their favorites. I've run into students who aren't even in HDFS, but other majors, but they've taken the course and they're like, I love this course. It's so useful, so
Mhm.
helpful.
That's wonderful. Yeah, it's one of those things where um we joke a lot of I mean, I bring it up a lot now, but in the beginning of my career, students kind of brought it up more often. but the need for maybe this class to be like required general education or just part of health education or life education, because so many young people don't get specific sexuality education, sexual health education in schools. And so a lot of times, unfortunately, the first time students are and young people are really interacting with and consuming like high quality, science on healthy relationships, sexual health, and even positive things like sexual pleasure and that type of thing is in college. And they're all like, we wish we would have had this information, years ago.
Yeah, and so I'm glad you're able to provide it, but it does make you wish that they got it sooner. So it sounds
Yeah.
like it would be
Better
helpful.
late than never, but yeah,
Yeah,
but it's nice to teach a class that people find useful.
yeah, yep, they do. From what I'm hearing, they do.
Oh, thank you. That's so encouraging. Sometimes you
Yeah,
don't know.
yeah. Well, I'm glad. So as an assistant professor, I know you wear many hats and you talk about teaching. You talked a little bit about your research. Can you walk us through like what a typical day or week might look like in your research lab and when you're
Yeah.
working with your students?
Yeah. So in all honesty, there has been a lot of uh, throwing things on the wall to see what sticks. Because, as you can imagine, culturally, we have a very um, bizarre relationship with sexual relationships and experiences, especially among youth. And unfortunately, that means that there's not a whole lot of research funding. So we have to think about other problems related to the topic of adolescent sexual development that are fundable. So a lot of times at the MSU R1 level or major research institution, we're really encouraged and in some ways required to get federal grant funding to do our research. And so we tend to kind of in my subfield tend to really go after funding for violence prevention, so sexual violence prevention, recently for mental health issues related to social media, and then really emphasizing how much, sexual content on social media and sexual harassment on social media experiences contribute to mental health issues, particularly for girls and for LGBTQ youth. So there's been some going after those pots of money that have kind of informed what the pilot studies are, so to speak, or data we need to collect. And so it's kind of been a little bit all over the place, but in many ways, I was just looking back as I'm writing up my tenure materials and things. I feel like I've been really lucky to do a bunch of cool work with my students and with other folks' students. One of the cool things about HDFS, and I want to say probably academia at large recently, is I feel like there's just a lot more collaboration within students and across labs. And so I really encourage my own students, to work with other faculty and other students, invite them to work with me on a project here and there. So we've been able to collect data with focus groups. So asking college students specifically about their perceptions of consent. This was right after the Me Too hashtag went viral. So that was a big topic of conversation at the time. And then what really informed that was we were able to do a Twitter analysis of a hashtag that had responded to Donald Trump's sort of degrading commentary about women grabbing women by their genitals, and then all the way to evaluating, a media literacy program for public school staff. And sometimes we're doing survey research, and then most recently, we have under review right now is a analysis of the sexual misconduct policies across secondary schools in the state of Michigan to assess for their comprehensiveness to include online sexual misconduct, as well as their specificity for defining in-person sexual harassment and how schools should respond to that. And so it's it feels like it's a broad range of getting at different pieces of the puzzle, but it's been fun to kind of see it move together. But that being said, I mean, to more directly answer your question, that means every week and semester is very different. So it's definitely not a lab where it's like, we're cleaning data, we're collecting this data, we're doing, this thing over and over again. Maybe it will be once I get a large grant and have, the infrastructure to do that for multiple years in a row. But so far, it's just been getting data that we need to add to the literature in order to make the case for these larger grants.
Gotcha. Yeah, so various stages and, various directions too,
Yeah.
it sounds like. And your work is so important because you're informing educators and education about this topic. And then also, looking to educate or inform policy on it, and so that's really important too.
Thank you.
Yeah.
Yeah, I was able to get a small internal grant, and for all of those out there listening or watching, small is $25,000, which sounds like a lot when you are an undergrad or even in graduate school. $25,000 grants, $50,000 grants. But what was a really hard lesson for me to learn is in order to do really high quality research, you need a ton of money. And not just to be able to do what you want to do methods wise, but be able to pay for investigators' time, because it takes time and energy to think about these things. So $25,000 is a ton of money, but it is considered a small grant in the research intensive universities. But I was able to get a small grant to at least be able to collect some data and pay some undergrads and pay for some graduate assistants as well to do this kind of deep dive into policy.
That's awesome. That's awesome.
Yeah.
And I like also the focus that you have on socialization and trying to influence those that do the socialization, the
Yeah.
parents, and so, and also what I love about your work is that the knowledge that you gain, you share it with many different audiences. Your speaking engagements that you've done. And for our people watching, you might not know that Dr. Maas did a TED Talk a couple of years ago, which was awesome. And so I like that you have found ways, I think, unique ways to share what you've learned through your research. And I think that's so important.
Well, thank you. Yeah, I mean, I really do feel like for those of us most of us who do work in HDFS, we're really in it to help usually families, definitely, people, younger people are usually in the mix, families, changing the way we either teach or parent or bring up young folks, or providing services and programming and interventions to help improve the trajectory of younger people over time. Other folks in HDFS programs across the country do also focus on aging and healthy aging. We don't have a whole lot of that going on in our department, but in general, it's like really people focused. Even if we're doing really rigorous scientific research, it's still very applicable. So I really feel like we have not just the ability, but kind of the responsibility to really disseminate our findings and, you know, articulate them in a way that can really help people immediately instead of needing to trickle down until 10 years from now it's in a textbook or it's a best practice somewhere. And that's not for everybody to do in academia or even in HDFS. I feel like it does take a certain demeanor or proclivity to talking to various different audiences, but a lot of times our science is very communicable, and why not spread the word. It can be kind of depressing as an academic when you look at how many reads one of your journal articles gets. It can be pretty small, but if you look at a tweet, which I don't know what tweets are called anymore, or a TikTok or a TED Talk video or a Huffington Post article or something, and you see that amount of reads or views, then it feels like, oh, well, at least that information got to those, at least those folks.
Yeah. And that's good too. Reaching people who need that information and want that. And I also like how you talked about the timeliness of getting information out, because in your topic specifically, when you're talking about online harassment and things like that, sexual misconduct that way, that's really important for parents and educators to understand that's going on, and to be able to help these kids to hopefully improve it so it can decrease.
Yeah.
Yeah.
We're in a kind of an interesting phase or window that might be closing, hopefully a little bit, where or the gap will be smaller, but the people who are raising teenagers right now usually grew up with very limited internet access in their home, no social media. Internet pornography was, behind, like a literal counter. You had to pay, and so it's a very different experience parenting teenagers right now, whereas parents of 5-year-olds, 6-year-olds and younger, they grew up with a lot of this stuff, and things are changing quickly, but not quite as drastically as analog to digital or pre-internet to post-internet. And so I think their scholars project that there might be a little more understanding, a little more confidence parenting teenagers 5-10 years from now than unfortunately the parents of the last 10 years or so, who are really the unique generational position of not having internet and social media, and then raising kids who grew up with all of it.
Yeah, you're right. That technical gap
Yeah,
won't be
exactly.
so
Yeah.
big. Yeah,
Yep.
that's a really great point. Yeah. So did you always know that you wanted to do this work in an area, or that your research interests would be sexual health promotion and the prevention of sexual violence? Can you tell us about
Definitely
your
not.
career
No.
path? Yeah. So what did you start out wanting to do?
No, not at all. I mean, I have a very non-traditional path. So I grew up doing theater and dance, and I was always really interested in filmmaking, and I actually worked as a production assistant and did stuff in LA or Hollywood at the time. for 4 years. And I did that. So I took a 4-year break to do that between my first and second semester of college. And I took my first semester of college at a community college. And I was like, this is so boring. I cannot do this another, week of my life. And then I went on this kind of wild adventure, but it was way too wild. I didn't have health insurance. Like every time I get sick, I wouldn't be able to get antibiotics or something. You'd have to go to a free clinic. And I realized I needed a lot more stability in my life. So I originally went to school for filmmaking, and then also realized that was kind of a waste of money because you can't, do much with a filmmaking degree in most cases. So if you're in a bunch of debt. But I always loved psychology classes. I was able to take some psychology class, and then another like socialization and media class in high school. Actually, we had electives, and in the back of my mind, I kind of thought it would also be fun to be a therapist. And so I actually switched and thought I was going to be a therapist, and specifically an addiction counselor. But then I did an internship while I was an undergrad psych major, and did an internship and realized I don't have the patience to be a therapist, and addiction is really boring because it's all the same thing kind of over and over again. But kind of, I don't know, going down those paths led me to think about other issues. And I just kind of on a whim signed up to be a sexual health peer educator in college, and was just fascinated by how many young people were talking about porn specifically. So this was like back in 2007. And then I started doing sexual violence prevention work on college campuses as a health educator, and they kept talking about pornography. And I thought, well, I wonder if anybody's doing research on this. And there wasn't a whole lot of people doing research on it. It was mostly like people doing research on pornography and like married couples. And then in those kind of practice-oriented experiences, I realized, wow, like we're just sort of all doing whatever we want to do in prevention education. Like there was a little bit of a push to choose programs that are evidence-based, but it was like, oh, let's choose this module and let's do that module and let's just see how this works. And anyways, I thought, well, maybe research, maybe program development, research methods, something related to sexual violence and media would be interesting, and would still have like a tie to filmmaking, would still have a little bit of a tie to therapy, but be more removed. And I applied to graduate schools, and I was able to get into the HDFS grad program at Penn State. And then that was just like a rocket, took off in terms of scientific training and understanding, and being funded by the National Institutes of Health and getting really rigorous methodology training. It was like a really intense 5-year boot camp. And I was really glad though, because it set me up timing wise for this job. And I've just loved working in our department. I feel like we're all so chill and cohesive and encouraging of each other. It's not as competitive and cutthroat as some academic environments can be. And I know for sure that things led to where I am, and I'm where I'm supposed to be and doing work that I love. But I never, if somebody were to tell me when I was, 20, that you would be living in Michigan with a family as a tenure track professor, researching sexuality or something, I would have fainted or something. It would have been, there's no way I would have ever, I mean, even just conceptualizing not living in California would have just been a non-negotiable. So none of this
Yeah.
was was intended, but I'm glad I'm here.
Yeah. Yeah. We're glad too. But yeah, that is quite a change from California to end up in Michigan with Michigan winters and
Yeah. Mhm.
yeah. And so I'm glad you brought some of these things up because it sounds like having some experiential opportunities to go out
Mhm.
and do something. For one thing, it taught you what you definitely did not want to do. And so that is helpful, you know, even though,
Absolutely.
yeah.
Yeah, if
It,
you don't, if I always tell people, students, um, you don't have to know what you want to do, but you got to figure out what you don't want to do and really be very clear about what you don't want to do, and think about that like day to day life. So like addiction counseling seemed kind of fun or interesting or, edgy. No, it is very boring and repetitive. Who would have thought? You don't try.
yeah, yeah, I can see that. And so, yeah, that experiential learning opportunity was really important for you and a turning point. And so I'm glad that our students get to hear that because even though it didn't work out, it wasn't a waste of your time because you did learn, what you don't want to do and you were able to adjust your path from there. And then sounds like it was a series of just opportunities and things you reached out for.
Hmm.
And
Yeah.
so, yeah, that's so helpful for our students to hear that.
Yeah. Yeah. Internships are great. Do internships, get part-time jobs. Um, yeah, just try stuff. I mean, you can even, it might not be ethical to get a job thinking you're only going to give it, you know, 3 to 6 months and see how it fits, because that's obviously not what an employer would want. Usually internships need to be at least a year. But if you can find opportunities that are shorter term, you might as well dive into those, and then you can really get an idea of what that is going to look like.
That's a good point.
Yeah.
Good. Um, good piece of advice. And it kind of goes along with my next question. What advice do you have for students who might be interested in pursuing a career related to sexual health?
Yeah, so there's a few different paths. Some of the best degrees to get are in public health and social work. Those are really great degrees. You can get, you could also get an HDFS kind of master's degree and then get certified as as a sex educator, or even for somebody who's going to go down like a licensed clinical social worker path, they can also get licensed to be a sexual counselor or therapist. The University of Michigan has a program that you can do online, and it is through connected through the American Association of Sexuality Educators, Counselors, and Therapists, or what we call ASECT. So that's a path for sure. But, getting a PhD in HDFS, getting a PhD in public health or social work, sometimes sociology, certainly um, uh, gender studies or women's studies, psychology, and women's studies programs combined can all, you can incorporate sexual health and experiences through that. Um, those are all ways to kind of, what's great about, sex research in general is that it's so interdisciplinary. There's a lot of different disciplines where you can focus on it. But I think the best paying master's degrees tend to be masters of public health or masters in social work. But if you want to go the HDFS PhD route, then that is also doable as well. And you could either be a professor at various different levels and then do, community work, sex education on the side. There's a lot of opportunities for that kind of thing. A lot of sex educators are freelance. And so you kind of have to have, a quote unquote real job, and being a professor is a really great real job. So those are more typical path options.
Okay. Yeah, good to know. I'm glad you talked about some of the programs that are out there that could be helpful with that, and also knowing different areas where you could work.
Mm-hmm.
That's good to know. Do you know, I know that our Department of Health here in Michigan has a department or area for sexual education
Yeah,
and sexual health. Do you know if they have internships available or anything like
they
that?
might. Yeah.
Okay.
Especially depending on the whatever grant they're rolling out. So like CDC the Centers for Disease Control gives a big chunk of money to each state for sexual violence prevention work. And that is usually doled out through different sex education efforts, whether they're at community level or school-based level. So yeah, the Department of Health and Human Services would likely have, if it's not a permanent position, more sporadic positions. But you could also find out a lot through MOASH, or the Michigan Organization on Adolescent Sexual Health. And a lot of the folks through the Department of Health and Human Services who are focused on sexual health work and sexual violence prevention work are connected to MOASH. And that can be a great way to get, connected to other state kind of level, organizations and needs.
That's great to know. It actually answers one of my questions too,
Yeah.
because it was like, what organizations do you
Yeah.
network with and connect with? And so it sounds like that one is an important one for your field, for your area of interest.
Yeah, it's a great, and there's a lot that you could do even just volunteer wise through MOASH as an MSU student. You can also do volunteer work and get connected through Planned Parenthood. You can do certification projects through them for community like health education. If you have, and if you can be an HDFS major, but then have a minor in public health and still get it's called a CHES, or a Certified Health Education Specialist certificate. It's basically an exam that you take, but you have to have a certain amount of credits of health education. And then you can teach sex education, alcohol and drug education, nutrition, all sorts of things in various different capacities. So that's also a nice option to think about if you're an HDFS major, but you're interested in this type of thing. See what kinds of public health classes you would need to be able to take that exam.
Those are some really concrete possibilities,
Yeah.
options for students. So I'm really glad that you talked about those. They might be really helpful because I do run across some students every once in a while who do seem to have a focus on wanting to go the sexual health education direction, that they have a big interest in that. And so I hope that they watch this so they can
Yeah.
maybe get some ideas of things they can do either for an internship or just volunteering and getting involved and starting to know those networks.
Yeah. Hmm.
Yeah, that's so important.
Yeah.
All right. So I only have two questions left. The first one is, knowing what you know now, what do you wish you had known earlier in your college career?
Well, I wish I would have known about HDFS as an undergrad or earlier in undergrad. I didn't find out that HDFS was even a thing until I was applying for graduate schools, graduate programs. And then realized, oh, wow, that would have saved me a lot of time because, as a psychology major, you're taking, cognitive classes and animal behavior and all of these things that are just really, they're fascinating, but they're all, individual focused. They're not about, families, neighborhoods, schools, systems working together. So I definitely wish I would have known about that sooner. I guess in some ways it would have been nice to also know about just more paths in general. I think there's been such a focus on not just getting a bachelor's degree, but getting a graduate degree, no matter the cost. And now the cost is, people are ending up with $100,000 in debt. I'm glad I am where I am. But I could have also been happy, I think, in paths that did not include the PhD, but I was too afraid to take those because I wasn't sure if they were going to, make money or if I was going to be able to pay back my student loans and things like that. So if you can, I would try to keep debt low so you can keep a lot more options open, because not every, terminal degree is going to be worth however much money you're going and, you would need to pay for it. So there's a lot of scholarship and fellowship opportunities. But just consider that there's a lot of ways to do great work in the world. I think you still definitely need that bachelor's degree. But in terms of graduate degrees, there's a lot of different options. So just keep your options open.
Yeah, I agree. I think there is.
Yeah.
And things that you can end up doing that are very fulfilling and rewarding, and maybe not have to go to school for so long.
Exactly. Yeah.
Yeah.
And I feel like I feel almost guilty saying this, as a professor at MSU, because it's a great life and I'm glad everything has worked in this way. And I encourage people to go to achieve their educational dreams if that's what, you really want. But don't give in to pressure that getting some kind of degree is going to solve all your problems, because there's just lots of ways you can live a really great life and make money without necessarily a graduate degree.
Yeah. And make a difference
And
too,
make a big difference. Yeah,
Yeah. Make a
for
huge
sure.
difference. All right. And so my last question is it okay if students contact you if they have any questions about your work and some of those organizations that you mentioned?
Yeah, for sure. I'm happy to chat or answer email or whatever.
All right, great.
Um,
I'll include your email address in the description of this episode when it gets put on YouTube. And I'll also include your website address too. Um,
Okay.
yeah, because that has a link to her TED Talk. So
Yay. Yeah. Oh,
yeah,
that's true. It does. Yeah.
yeah, it does.
Yeah. Okay.
All right, great. Thank you so much for joining us today. I really appreciate all of the knowledge that you shared and your experiences. I think our students will get a lot out of it.
Well, thanks so much for having me. And I'm so glad that you're giving this resource to our students. I mean, I feel like, we need more opportunities to just hear like real world career trajectories, you know, because
Yeah.
it's nice to see where people are at, but you want to know kind of how they got there.
Yeah. Yeah. Thank you. I hope it's going to help a lot.
It
So,
will. It
all
will. For sure. Yeah.
right.
All right. Well, thanks, Lori.
Thank you. Thank you for joining today's episode of the HDFS Career Podcast. I hope you enjoyed meeting Dr. Megan Maas today and hearing about all the great things she has done in her career and what her career path has been like. And I hope that information has been helpful to you. As we talked about towards the end of the interview, you can find Dr. Moss's contact information in the episode description. If you she would be happy to answer any questions you might have about her career or how to pursue a career similar to hers in sexual health promotion or sexual violence prevention, or any of the organizations that she talked about in this interview. Please join me again soon as I interview more professionals to give you an idea of the types of things that you can do with a degree in HDFS. I hope you enjoy the rest of your day.